Welcome and good afternoon. My name is Jeremy Harris, and I have the pleasure to serve as the Chamber's President and CEO. And today's joint webinar presentation is with AECOM. This webinar is a series of many webinars the Chamber has continued to host and co-hosted, and also that we provide to our membership in the greater Long Beach community. We've got an excellent webinar today and a timely one at that. Today's topic is re-occupancy and return to service best practices. I'm sure many of us have been following the health orders and the recent reopening of certain businesses, albeit a very select few and select industries. But we're also anticipating future openings in the near future as long as the numbers continue to trend downward. This is evidenced both by the San Diego and Orange counties coming off the recent monitoring list. It's our hope that Los Angeles County, which of course encompasses Long Beach, will follow suit as well. So with that, let's get on to our presentation today. And once again, thanks for joining us. We've got two great speakers this afternoon. I will introduce the first one here shortly. I will serve as your moderator today. And if you have questions, please use the Q&A feature that should be found the icon bar at the bottom of your screen, or if you're on another device under settings. We will save the Q&A to the end after both presenters have had a chance to present. Also, this webinar is being recorded and will be shared with all the attendees today and also with the members of the Chamber. If you want to know about membership in the Chamber, just send me a quick note in the chat box feature and someone from our team will follow up and we're happy to discuss more about that. So let's get on with our first presenter. Our first presenter this afternoon is Lori Chu. She'll be speaking to return to service, disinfection, and ongoing pandemic planning. Ms. Chu is a senior health, safety, and environmental specialist at AECOM, has over 20 years of industrial hygiene, occupational health and safety, and environmental experience. Ms. Chu manages and supports occupational safety and health management system and regulatory compliance projects. She provides technical assistance to clients in the commercial and government sectors. She has an experience within a wide variety of industries, including aerospace, educational institutions, laboratories, refineries, hospitals, automotive, and construction. Ms. Chu currently serves as AECOM's COVID-19 planning and re-occupancy team. She has served on the UCLA hazardous materials team and as a laboratory safety officer with UCLA. She has worked as an inspector and district manager for Cal OSHA, where she performed hundreds of health and safety audits, and conducted investigations of fatal accidents. With that, please welcome Lori, and Lori, the floor is yours.
Thank you very much. Today, we will be going into return to service planning, and that will include our, starting with state and local context. So just understanding how local, state, and City of Long Beach orders, public health orders, are for your particular jurisdiction. We'll also go into return to service goals and concepts, basic concepts. And then after that, I will hand it over to Deanna, and she'll be talking about meeting and workshop strategies in light of the pandemic, as well as provide specific case studies and examples. And finally, as mentioned, we will open it up to Q&A. So just to give you a big picture of the state of California as we return to service, hopefully you've already watched a number of Mr. Governor Newsom's newscasts, which include speaking about our resiliency roadmap, which includes our stages as we return to service. So we go from stage 1 through stage 4, which stage 1 is being the most conservative, when we were all staying at home basically, and not as much as possible, not congregating in large groups. We are now currently in stage 2. We're starting to open up lower risk workplaces, such as retail, manufacturing, and offices with limited hospitality and personal services. We're able to do those services on an outdoor setting, and then also modified childcare and modified school programs. As we move forward and hopefully again reduce our community spread, then we can move into stage 3 for reopening of our higher risk workplaces, which includes more hospitality and personal services, as well as entertainment such as movie and theaters and sports without live audiences. And finally, our goal is to reach stage 4, which will be the end of our stay-at-home orders, where we can start opening up our highest risk workplaces, which includes concerts, convention centers, and sports arenas. So the state of California basically issued a number of guidelines for reopening, and these guidelines roll down to the county and then down to the city of Long Beach levels. So the state has expectations for us as businesses to perform these actions so we can open our workplaces safely. And that includes performing a detailed risk assessment, which is basically categorizing risk as high, medium, or low for your job tasks or job titles in relation to their risk to COVID-19. And based upon this risk, we would create and implement a site-specific protection plan to control these risks. We also want to train our employees on COVID-19, implement control measures and health screenings, again, based upon the risks to our workers, implement disinfecting protocols, and implement physical distancing guidelines. And in the city of Long Beach, we specifically need to abide by the Health and Human Services orders and protocols. So specifically in the city of Long Beach, Health and Human Services has jurisdiction here, and there is an expectation that all businesses complete and post the city of Long Beach physical distancing protocols. And this is basically a 4-page checklist that is pretty much pre-populated for you. So the city is trying to help make it easy for you to fill out this protocol and then post it to make sure you have the basic guidelines and procedures at your workplace to keep your workers, yourself, and your customers and clients safe. And then on top of filling out this actual physical distancing protocol, there's also an expectation by the city to make sure you abide by business sector protocols, which hopefully you're somewhat familiar with. Again, these are available on the Long Beach Health and Human Services websites, which are listed here. And just for a basic example of what the physical distancing protocol looks like, it's actually a screenshot here on the screen. Again, it's a 4-page document, and you can see again that it's already pre-populated, and you just need to check a couple boxes of what you're doing at your specific workplace to make sure you're abiding by the city's requirements to reopen. And it does have basic listing of your business name, facility address, and then on the last page, it includes information on a business contact and phone number. And as I mentioned, there are specific protocols for industry and business sectors. So the big main physical distancing protocol is the generic catch-all for all industry sectors. But Long Beach does have specific requirements depending on what type of business or industry you operate on. And there are obvious caveats if you're opening a school versus opening a dine-in restaurant versus opening a retail shop. And these are delineated in these published protocols. Jumping from the specifics of Long Beach to general return to service goals and concepts. As we return to service, we do have main goals of obviously wanting to keep our employees healthy and safe, as well as our clients. Oh, was there a question? Okay, I'll continue. We also want to have workplace plans to decrease risk of infection, again, to our employees as well as to our customer and clients. And we want to maintain trust of our workforce so we can maintain an efficient and effective workforce. We want to clearly communicate changes and encourage desired behavior, not only among, again, our employees, but also of our clients and customers. And then we most definitely want to demonstrate compassion for the mental and physical well-being of our employees. So to help achieve these goals, we want to have or go through basic key concepts of transmission related to COVID-19, basic planning and management strategies, workplace design, organization and flow, controls, medical surveillance, communication, and planning for the future. And I will go through these fairly swiftly just to make sure that Deanna has time for her portion of the presentation, and most definitely feel free to ask questions at the end because I will be going through these concepts fairly swiftly. In regards to transmission, it's important to recall that SARS-CoV-2, which is the virus that causes the disease COVID-19, is spread primarily through droplet transmission. This means person-to-person contact from droplets from a person coughing or sneezing. And it's an important concept to note that if we limit the close contact between an infected person and from others, that this is the key in breaking the chain of transmission of COVID-19, again, from the droplet transmission. There are cases where singing, talking, or shouting in close, dense conditions, such as a bar, or we have cases in a choir setting where persons were not wearing masks and were close together for a long duration, that there has been transmission from singing, talking, and shouting. There also are cases or possibility of transmission from touching a contaminated surface. So if you touch something that has been contaminated with the virus and then touch your mouth, nose, or eyes, you may also contract the virus from the contaminated surface, although this is not thought to be the main pathway of the spread of the virus. Again, the main pathway is through that droplet transmission from coughing and sneezing person to person. So again, to stop the spread, we need to make sure that we cover our cough, that we stay home if we're sick, that again and again, over and over, you hear that we need to practice physical distancing of 6 feet or more, make sure that we wash our hands frequently with soap and water. We need to wear a face covering or face mask. And then we also want to perform daily health screenings. And these are the main practices that if we implement, that we will significantly reduce the spread of the disease in our communities. Going on to basic information or concepts related to planning and management. Again, hopefully all of you are in the midst of returning to service, opening your businesses, and have already considered these key concepts and discussed them and got feedback from your human resources, your IT team, real estate, marketing, your engineering teams, facilities, operations, production, finance, legal, and also obviously your employees to get feedback from them on your basic planning and protocols. As part of this master planning, as you return to work, we should have information on pandemic planning, physical distancing, what to do if we have a COVID-19 positive case in our workplace, basic workers' compensation information, how to get medical care and testing for our positive case, tracking isolation and quarantine of our positive case and those they've been in contact with, disinfection protocols, basic hygiene measures, and business continuity planning. And then as you are all probably aware of, this is a very dynamic and fluid situation. And as we keep learning more and more about the virus, our safety orders change, and they also change as community spread hopefully lowers as we move forward in time. So making sure you keep apprised and abreast with local and state government requirements. In regards to workplace design and flow, again, hopefully you're at this point in time, you're familiar with these basic concepts, but relooking at occupant density, not only in your building, but in specific office locations like your conference rooms, also looking at occupant density in production floors. You're probably already seeing that quite frequently at your grocery stores where they're trying to limit the number of people in a specific location at one time. So basically looking through your own workplace for space usage and workflow and seeing how you can maximize physical distancing of your staff. To look at the established flow of people into and out of the office on the production floor, and also looking at high density locations or choke points, such as stairwells or elevators or entrances to buildings. We've also seen that we sometimes forget about transportation to and from work. So we've also seen that a lot of times our employees tend to commute together in one private vehicle, and just reminding them again, that's a case where they're within 6 feet of each other and can actually transmit the disease at that point in time. So to encourage people to maintain the physical distance in that private vehicle and even perhaps open windows while they're in that vehicle. And also if they're using public transportation such as a bus, to again encourage and remind employees to keep that physical distancing on the bus. And then obviously as soon as possible, wash hands or use hand sanitizer after exiting the bus. Other concepts are related to staggering start and stop times to the workday, so we can get people in throughout the day and not all at one time, and also staggering breaks. And also finally, looking at our remote work opportunities to see if people who can still and continue to work remotely to keep supporting that activity. In regards to controls, we do want to look at our heating and ventilation and air conditioning systems, and as feasible and as economically feasible, look at seeing if we can improve filter efficiency, increase fresh air intake, and increase operation time. So typically we may just run that HVAC system from 8 a.m. to 5 p.m. We can even consider operating the HVAC 24/7 or start operating it earlier. So instead of starting it at 8 a.m., start it at 6 a.m. and continue to running it till 8 p.m. You also probably are familiar with the concepts of cough guards or plexiglass screens, where we can't keep that 6 feet of physical distancing because we can on a production line, then to try to put up either screens, placing curtains in between workers, and then also placing visual cues for physical distancing and also flow through the workplace. So again, at the grocery store, you've probably seen, one-way flow of traffic. Some of my clients have done hallway, A as heading east and hallway B heading west. Stairwell usage designated for up and down for one stairwell and the other stairwell, encouraging the use of stairwells rather than the elevator. Also, we need to implement and schedule regular disinfection protocols. We should look at our use cases for face masks, face shields, gloves, and respirators, depending on our job tasks. And then also making sure we have ample supply and availability of hand sanitizer and hand washing facilities. In regard to disinfection, hopefully you're aware that the EPA has a List N, which lists all of the disinfectants that are registered with the EPA that are capable of killing the COVID virus. So again, if you want to look at this actual list to verify that the disinfectant you're using in your workplace is effective, you can go to this website. Again, it's over 400 products long, so that you can actually extract it into Excel format, and then you could perform a search on it. Just be aware that the products on this list do have specific requirements for application. Typically it's spraying, or it could be immersing. Some of them are fog. In general, it's a spraying application. And also be aware that you have requirements for contact time. So you would spray the particular disinfectant, and oftentimes you have to let that spray sit for about 10 minutes for it to have adequate contact time to kill the virus, and then you would wipe it down. And the other concept I wanted to go through is the concept of clean, sanitize, and disinfect, where cleaning is basically taking off visible dirt off of a surface. Sanitize reduces the number of germs, but doesn't completely kill all of them, to try to make the surface to a safe level. And disinfection, which is this EPA list, is the goal of actually killing all of the virus, which if you look at this chart, for disinfection, you would have only 1 out of 1 million germs or virus particles left on the surface after you disinfect it, where sanitization is not quite as effective. You would still have 1,000 germs left, and cleaning you would have theoretically 10,000. And basically this chart just means that disinfectant is basically the strongest chemical product you can use when compared to a sanitizing product or cleaning product. Quick notes on disinfection: there are a variety of disinfectant chemicals on that EPA list. For the alcohol, that's typically what you're seeing in your hand sanitizers. There's also quaternary ammonia compounds that are recommended for hard surfaces. Accelerated hydrogen peroxide also recommended for hard surfaces, but should not have uncoated metals. It could actually corrode uncoated metals. And similarly, bleach is also for hard non-porous surfaces, but can also affect uncoated metals. And in regards to bleach, just be cognizant that it can be irritating to the skin and to the respiratory tract. So with all these chemicals, make sure to follow manufacturer's guidelines and also PPE requirements based on the manufacturer's guidelines. Real quickly into the concept of controls. We have controls related to face coverings and N95 respirators, and there has been some confusion as when you would want to use one over the other. So basically the face covering is placed on you to protect your germs, you from spreading your germs to other people. So this is really source control. In contrast, the N95 is placed, if you put an N95 on yourself, you're actually protecting yourself from other people's germs. So just make sure that there's a difference in the two, between the face covering and N95, and that we want to try to preserve the N95 really for our medical professionals. And the CDC, LA County guidelines, and City of Long Beach protocols are for us to use the face coverings or face masks. In regards to medical surveillance, this is just making sure that we take care of any positive COVID-19 cases in our workplace. So making sure that if we have a positive case, we have a means to test that person and also perform contact tracing and employee notifications that we've had a positive case in our workplace. And we want to do that while we maintain the person's identity. So we do want to notify the employees that there is a positive case, but we don't want to tell them exactly who that person who tested positive. We also want to ensure availability of employee assistance programs, so basically mental health support for our employees. And then again, as the basic concept, to have the daily health surveillance performed by our employees to ask them if they feel healthy that day, if they're fever-free, and if they haven't been or had personal exposure to another COVID-19 positive person. In regards to communication, we want to make sure we maintain transparency with our employee workplace, as well as provide consistent and clear messaging and clearly communicate our changes. Again, it seems like on almost a daily basis, we get different information from the CDC or the City of Long Beach. And so again, just making sure to maintain that clear communication pathway and make sure it's a two-way pathway, both soliciting information and feedback from our employees. And then really quick on the workplace for the future, to just think about what we may look like a month from now, 2 months from now, a year from now, in regards to COVID-19 impact on our workplaces. So Deanna will go into looking at virtual reality training and collaboration, thinking about smart workplaces where we can institute or implement sensor activated controls for our lighting, for our doors, for our toilets, faucets, and voice activated controls. And then thinking about changing out our work surfaces to be non-porous. So if we have carpet or if we have fabric for our chairs, going into plastic or going into non-fabric surfaces. And then really quickly, examples of how AECOM has assisted clients with instituting the reopening plans. We helped the Downtown's Women's Center, which is a homeless shelter in Los Angeles, with their reopening plans. We actually helped them with their design and workflow of how different populations would enter the building at different times of the day. And then we also assisted with their basic planning for their aerosol transmissible disease plan, their communication, and their training. And finally, we also assisted the Port of Los Angeles, where we focused on their master reopening plan as well, and also looked at specific risk assessment processes for their port pilots who have a community housing situation at their workplace. And with that, I will hand it over to back to Deanna.
Lori, thanks for that. That was an excellent presentation. I'm sure we're going to have some questions here. A lot of information to get through and a lot of good information to take back and share with our team members and then, of course, our businesses. So thank you again for that. As we get the next presentation pulled up here, I'll go ahead and introduce our next presenter, which is Deanna Weber. She will speak to the community return to service strategies. Deanna Weber is a vice president with AECOM as a leader and innovator in return to service, sustainable and resiliency projects. She effectively facilitates and leads multidisciplinary integrated delivery teams to innovatively solve clients' challenges. Deanna is AECOM Southern California City's lead, working with public sector clients, including responding to return to work and return to service challenges. She has a deep experience managing complex projects from conceptualization to construction, implementation, and is passionate about seeing the integration of resiliency and sustainability in a cost-benefit context. Very important there. Deanna leads teams and facilitates project execution, including supporting the City of Pasadena's with their reopening protocols, the City of San Diego's virtual open houses to engage the public effectively during COVID-19, and the County of LA with their general hospital facility study, which was to reuse the county's largest real estate asset of 1.3 million square feet. She has a master's degree in urban design and planning from Harvard University and a bachelor's with honors from Penn State University. Deanna, welcome, and the floor is all yours. Thank you.
Great, thanks, Jeremy. Hopefully you can see my screen now with return to service.
We do see it.
Great, so this is an example, one of many we're going to talk about today, strategies and tools to really engage and help facilitate the meetings that you have with your clients, with your teams, for businesses, cities, counties. This is an online virtual open house tool that we launched with the City of San Diego, which has been very successful. We'll do a demo of this at the end. But really what we want to ask today to the larger audience is, how are we adapting in real time and responding to COVID-19? We're 6 months into the pandemic, and there's a variety of strategies that you may or may not be using that we want you to at least consider in terms of making your virtual workspace and your collaborative space with your teams and your clients and your colleagues more effective. You know, we were having public meetings, many of us, community Q&A, and we're shifting towards virtual tools such as today. When we think about stakeholder meetings, we have some ideas on interactive mapping and commenting. Our coworker and team meetings, certainly there's collaborative software that we all need to be thinking about. I know from myself personally, you know, we work with a lot of different clients across the country. Here's one example of workshops that we facilitate with NASA Ames for their Campus of the Future. You can see it's very engaging, it's very hands-on, and we're using many different methods and tools from, you know, the Lego master planning method, all the way up to flip charts, etc., and dot exercises that I'm sure you've been involved with. So when we think about how do we effectively pivot to online, we've got some lessons learned to share today on what's been working and what's also been less effective. First thing, I think it's important to note that you've got to establish confidence with your team members and your clients that you can shift to an all online platform. One of the interview questions we had with a client with a transportation agency in the East Coast, as seen here in this image, they asked us in the interview, can you do the entire project online from start to finish effectively and engage a broad range of stakeholders? And the answer is absolutely yes. We frequently use, if at all possible, if they allow Zoom as a platform, because Zoom allows for breakout sessions. We find that very effective. WebEx also now allows that. Teams will be catching up, I believe, but we don't have that function just yet on Teams that we do a lot of work with our government clients. Here's an example, though, on one of our workshops with the client. This is the CEO of the organization. At the end of the meeting, we had a great time for their head of marketing she shared with us her son that was recently born, and their basically chief executive officer holding up the toys that were left in her office space at home from her children, who she's multitasking, working, and taking care of her kids. But we're seeing a lot of wide variety. We can't encourage you enough to turn your video cameras on, because it makes for great conversations, including when you go online early, to learn about the story of where people are working, as well as we're using Google Earth for a lot of site tours. We just actually did a detailed site tour yesterday of a large site in the Mojave Desert. Thankful we didn't have to go in person, but to be able to literally get down at Street View, walk around, and then our energy teams are also in buildings working with our clients to be able to do FaceTime site visits within buildings as well. So another thing to think about in terms of digital collaboration, there's a tool we've been using quite frequently called Mural. If you're a facilitator like myself, you frequently love the big whiteboards and markers, or using your sticky dots and flip charts. Imagine this as a big whiteboard in order to allow your facilitators and yourself to grab sticky notes from the side here, different icons, etc. Or you can actually allow all the participants all at the same time to work on an exercise together as well. Here's an example of what that might look like. For example, we had 3 different breakout groups, all needing to address what we call the triple bottom line of environment, community, and economics. In this case, we didn't have all 35 participants typing in different strategies, but to have each facilitator with a scribe for each of those breakout groups in Zoom, they were typing in all at the same time. So you've got 3 breakout groups. You can see real time. The beauty of it is at the very end, you have a final product that the entire group has worked on together. But you may think, well, you know, Mural's free for 30 days. That's great. But at some point you may have to buy it. You want to stick with PowerPoint because you're comfortable with PowerPoint, and that works as well. What we found is there's a lot of flexibility within PowerPoint to build templates. Here's a template that our graphics team built, which is the same sticky exercise that we just saw in Mural. It just has a slightly different look on it, but you're able to click on the pre-populated X's there to literally have a workshop with your team rapidly in order to document your findings as you go along. So keep in mind PowerPoint, and to be able to share documents live on Teams so you can all work on the same document or Google Docs at the same time is really important during these meetings and workshops in order to have a record of what's occurring. Another idea, which I'm sure you've been involved in meetings recently to keep your folks engaged as you go along in the process, is to do online polling. Slido is a tool that we use for that. There's also obviously online questionnaires, and frequently too, we'll send, for example, like a survey monkey, a survey ahead of time to certain meetings or clients to get a pulse on what people are thinking, and then do online polling as the meeting occurs to keep folks engaged. Here's another example working with one of our academic clients at CU Boulder, where we have been doing a lot of breakout sessions, in this sense using Zoom. Then we're using PowerPoint as our tool in order to do dot prioritization exercises in each of those breakout groups. We found in these workshops, it's really helpful when you have more than, let's say, 20, 25 people to have a designated quarterback or master of ceremony to be able to coordinate and make sure that each group is effectively working, and folks can be able to switch groups as well as needed throughout the time. And then each basically breakout group, we typically have a dedicated scribe and a dedicated facilitator. And what we certainly have found, it takes a lot more work than a typical meeting in the sense of preparing ahead of time. Usually at most meetings, we'll bring flip charts and different tools with us, and we'll do a little bit more on the fly. What we find now in this virtual environment, you've got to be extra prepared. You do a dress rehearsal. You've got backup methods and tools ready to go if there's a problem. In addition, I mentioned earlier the virtual open houses, which I'll share a demo of it at the end here, but we have found for many clients that need to get a lot of feedback from the public to inform their process. In this case, it was the real estate assets department with the city of San Diego. They, right before COVID hit, they had a very big project, a sports project that they had to basically get feedback from the public on in terms of which development proposal they were going to go with. So we rolled out a tool that AECOM developed. There's other tools out there for virtual open houses. And we partnered with the city. So they basically launched through the press, social media, their email lists, etc., a 10-day live virtual open house that had really impressive results, over 28,000 visitors, over 500,000 visits, and over 6,000 questionnaires completed. Took about 5 minutes each for each questionnaire. So what we're finding is that although we still have a digital divide, and we're working with our clients in LA County and in City of Los Angeles and other cities around Southern California, how to expand and reach those people groups that may not have access online. So there's different tools and ideas we're using for that, but we found this to be very successful, and we'll be launching the second virtual open house tool on another project with the city shortly. Another interesting project, both Lori and I and our team has been involved with the city of Pasadena, helping them with their reopening protocols. And this was when offices and retail and restaurants weren't open yet. So we were helping the city with understanding, like the city of Long Beach, city of Pasadena has their own health department. So we worked closely with their health department to essentially take that information, look at best case examples and best practices from across the country, not just locally and within the state and within the county, and to be able to basically create very graphic friendly, easy to use reopening protocols. What that looks like, as you can see here on the screen, is the reopening for office space. Ultimately, it arrives at a very simple checklist to make it very, very clear what's needed as you go along and check things off. You've got live links, and this is also a document that is frequently updated as things continue to change. And then at the end, you basically have the person responsible, for example, for that office reopening, ultimately signs off and then posts this on their place of business. But again, the idea here is to make sure, even if you have a very small business and you're just thinking about reopening and you're transitioning between online and some in-person presence, to make sure that those steps for reopening are really, really simple, very clear, easy to understand. So as we also, City of Pasadena as well, launched one of the virtual open house tools, even more robust one than San Diego. In the first week alone, we had 500 visitors. So we found it very effective in that sense. Something to keep in mind is you may need to run your virtual meetings, and there's a whole different series of strategies we'll talk about here, but this data came out even prior to COVID, which basically says 95% of business professionals say that they're multitasking during meetings. 37% of them are losing track of the information as it's being discussed in the meeting, while over a third of them have trouble retaining the information. So what are you to do? Well, 9 of 10 people said that having a strong narrative and a story behind what you're presenting is really important. And almost 80% of the correspondents said that the use of animated visuals in presenting your information to keep the audience targeted is really, really important. So when we think about those virtual meetings or workshops, there's obviously a whole series of workshops in terms of informing and planning and decision-making and creating. It's important to be thinking through what are those exercises, what's ultimately the results that you want from that meeting, how can you help inform that meeting or plan for that meeting using different tools, including live feedback tools in the midst of the work that you're doing. Another thought, as we talked about earlier, in terms of when you've got decision making or you're creating or designing or exploring those different examples of mapping that you can do online real time in your meeting, whether it's a small meeting of a couple of folks, all the way up, we've had virtual meetings of probably over 30 to 50 participants as well. And that's the importance of being able to break them down into smaller groups and then reconvene in the larger meeting to be able to report back and share back those results. But as I mentioned earlier, it does take a lot of work and effort. So be thinking about that to run an effective online meeting or workshop, 1 week ahead of time. You need to be confirming all your materials, ideally sending those materials at least a day before, making sure that people understand and come to that meeting knowing that they're going to have to roll up their sleeves and do some work. And then ultimately the day of your workshop to make sure that you've got your backup strategies in place. Some meetings we've even had to pre-record certain videos if folks did not have good bandwidth or high-speed internet. So be thinking about all those different strategies as you move into this virtual workspace that we know that we're going to be in for quite a while, and it's going to be a different type of environment when we think about even returning to the office, so that we can have more participation from a broader group of folks that will be virtual, but also to be able to accommodate in-person participants as well. So a couple different thoughts in terms of formats for those workshops, whether it's a single workshop or a workshop with many breakout groups, who that host would be, who the subject matter experts are, and then what tools you're using. And then ultimately being able to share workshop etiquette extensively with your team ahead of time. We frequently dry runs to make sure that folks' audio, video, their backgrounds aren't distracting, those types of things to make sure that we can be prepared and keep all distractions to an absolute minimum. Another thought I wanted just to share with you as we wrap up, and then we'll open it up for Q&A after the virtual tour of the online open house, is many organizations that we're working with have a return to work playbook, and it could be quite extensive. Some aren't quite as extensive. We actually have folks embedded in the MBA bubble supporting with mechanical systems, with disinfection procedures, and making sure that people are actually following the playbook. So that's one extreme example. We're also working with colleges and academia, and then we're working with businesses as well as folks that run large arenas, and you name it. But having a good playbook, even if you're a very small business or you're a city, is really important to make sure that you keep that playbook updated, you keep expanding it. As we know from our COVID-19 team, a team that meets every single day, Monday through Friday, since COVID started, they're sharing best practices and what we're learning every day, because it's an evolving target, as we know. So it's important to have a great playbook. It's important to be thinking about what now partial reoccupancy looks like, and ultimately in the long run, what your sustainable occupancy will look like. Here's an example from just one playbook that our Strategy Plus team developed for the government of Canada. They came to our team and said, we have all these different departments. We have lots of protocols out there. How do we package it and put it in a usable, easy to understand playbook that each of the department heads could use and roll out with all of their employees, and then ultimately roll out to the people of Canada. So here's what it looks like. It is now an online document, so we're able to share this information. But like many of you, whether you're the government of Canada or you're a small business owner in the city of Long Beach, you're going to start with planning and evaluating and reevaluating and identifying what your needs are. You're going to be assembling and acquiring the tools and the individuals and the time and resources and budget that you need, anywhere from sourcing and looking at the supply chain of your disinfectants, all the way to detailed procedures of when people arrive, perhaps at your office or your place of business. You're going to, again, reevaluate and then prepare, ultimately enabling the leveraging of your resources. And then once you think you're done, you're actually going to reevaluate again and modify your planning, because we know as this continues to change, as we evolve in this COVID environment, it's important that we stay up to speed on the latest protocols that Lori talked about. So real quick, just the virtual open house tool I'll share with you. You start with a splash page. We've developed this so start with a video. And that open welcome video can explain what's happening, as well as you can basically start your online engagement and basically look at and walk around the room as you're a participant to understand what the different components of the virtual open house tool are. You can customize the space, customize the people, but as if you're going to go to a public meeting, you would frequently go around the room, look at the different presentation boards. You might hear a presentation. We've got that presentation here. And then ultimately you're going to look at what's the actual materials that you're going to be looking in this particular open house. So you're able to download all of the PDFs of all the materials. In this case, it was a sports arena concept that Brookfield and ASM was presenting. There's another example of a second concept that another developer had come up with. This was the Midway Sports and Entertainment District. You're able to click on the materials to be able to understand more about that particular proposal, including design, etc. And then you're able to ultimately provide feedback in the form of questionnaire, chat, etc. We've also set this up so that it can be bilingual, trilingual, number of different languages. And that also what we found, it's important when this particular one we launched for 10 days, we had a live chat function with staff basically available to answer questions live as well. So basically with that, we want to pause and send it back to Jeremy.
Deanna, thank you. Wonderful presentation. Lots of great information that hopefully our folks are going to be able to use and utilize, whether they're a small, medium, or large size business, or if you're in the public or private sector. So a lot of great things. Let's get into a couple of questions here. And just as a reminder, if you have any questions, hit the Q&A feature on your bottom bar there, or if you're on a different device, hit the Q&A at the top under settings. But a question for probably both of you. We'll start kind of with a general one, if we will. In all of your guys' work that you're doing, what have you found to be the biggest challenge for a business to reopen? Whether it's following rules, the cost of reopening because of the inclusion of PPEs, or just understanding the rules. So just kind of general, I'll throw it out to both of you.
Yeah, I'm going to have Lori start because I know she's kind of in the midst of working with a lot of clients there in and around Long Beach first, and then we'll talk about across the country what folks are finding.
Sure.
Yeah, I think for us, it was making sure to communicate all of the planning and procedures clearly to the different employees as they came back into the workplace. So a lot of times the employees were actually working from home and communicating to people at home prior to them getting to work. So again, having procedures available on a website that they could all access prior to getting to work, so that they were prepared before the first day that they actually step back to the workplace. So again, keeping that really clear communication chain.
Great.
I also have found, working with anywhere from professional sports organizations to cities and counties and business owners, is that frequently they'll have a plan, they'll have a playbook, and they'll say, we thought, and we'll have an early conversation to see if they need any support, any third-party review. And what we'll find is maybe a month or two later, they said, we thought we had our plan in place, but things have come up and it hasn't quite executed exactly like we thought, and things have changed on us. So we need to kind of rethink our playbook and rethink how our operating procedure might look. So it's really building in that flexibility to make sure that you can respond quickly and efficiently to those changes. I also think that what we personally have found in our own offices is spaces that you thought were big enough to accommodate large size meetings. Our conference room, which is, used to assemble 25, 35 people. Now, thanks to our certified industrial hygienists who've gone through and looked at all of our different spaces, that can accommodate maybe about 6 to 8 people now, that large conference room. Our conference rooms that used to sit comfortably 5 are dedicated now for 1 person. as well as all of the spaces are hotel spaces, you know, what type of clear disinfection protocols are going to be in place. We actually have a green card and a red card. We have an online login that we use when we go into the office. You know, some people may want to bring their keyboards and mouse with them just for additional, you know, being able to touch less surfaces. So we're seeing a whole variety of things that people need to be effective and nimble and quick. We're also seeing lots of cities and counties and businesses operate outside. You know, I was just over at the library in my neighborhood, and in the library parking lot is a huge tent. And I was thinking it was going to be online drive up pickup for your library books, like I believe you all have. But it was a nail salon in the library parking lot. And I thought that's pretty creative that somehow they made that work. So I think that's really important. You know, there's clients who say, you know, we were ready to open our central library, but things have changed. We're concerned now. How do we adjust and respond accordingly? So I think to actually take it slow and make sure that there's kind of very calculated, measured results prior to ultimately executing the playbook and being able to be nimble and effective to respond.
That's great, Deanna. And if I may, let's stay on the playbook piece. And then you talked about that pretty at length during your presentation. But I think you mentioned the playbook can be used or could be created, that is, for small, medium, and large size businesses. So it's not if you're a large business, you have to have a playbook. No, if you're a small business, you probably should have one as well and utilize it. Am I correct there?
Yeah, absolutely. Great point, Jeremy. The fact that, you know, we will see smaller businesses may have like just a simple fact sheet, and they may have, it might be like down to one page with different check boxes. The simpler, the easier, the better it is to understand. And what we've also found to make sure that that fact sheet or that playbook, whatever it is on a location that can readily be updated by those that are in charge of the reopening protocols, and then staff can easily get access to it with live links. And what we're finding too, I'll have Lori jump in, to be able to tie this to some tools out there and databases to be able to help track your employees and track some of the results. Lori, you may want to share some of the those online tools that we've been using and you've been using, like at the Port of LA, the LA Women's Shelter, etc.
Yeah, so we've been trying to institute using software, cloud-based software programs. Typically they're used for health and safety to help track regulations, keep track of data. There's health surveillance tools where you can interface with your mobile phone and enter in your health information for that day before you start work, just so that it's an ease of tracking the data. And also ease to the employee because they can access that tracking through their mobile phone. So we have been interfacing with different companies specifically for the health surveillance, but also on the contact tracing side. So we've helped implement contact tracing just to make sure that we can, as an employer, make sure that we can identify the person who is COVID positive, make sure that they're getting the correct follow-up care. So we want to make sure they're taken care of. And then also understanding and knowing when that person will fall off quarantine so they could come back to work. And then more importantly, also tracking who they were in contact with on the day that they potentially came to the office. You know, were they in the lunchroom and they talked to person A, B, and C? How do we make sure that we capture talking to those people, communicating with them, and following up on whether they are healthy, and also if they need to also be isolated from the workplace until we confirm that they're negative for COVID-19.
That's great. Well, thank you, Lori. And Lori, we're going to stick with you on this next question here. We've got time for this question and one more before we wrap up. But you'd mentioned in your presentation a pretty extensive list of disinfectants and different types and what they're used for, and the proximity of how well they will disinfect, or for lack of a better term, kill the virus, right?
Mhm.
And I think it was about 400 that were listed. You download and you can put into an Excel spreadsheet.
Yes.
You know, for our viewers and folks that are watching this, and I'm not looking for you to, you know, say one is better than the other, but if we're in an office space setting, do you recommend any type of disinfectants or ways to go about cleaning surfaces?
Yeah, so in general, we've been using quaternary ammonia products, which is basically any over-the-counter spray product.
Okay.
So again, if you go to a grocery store, you go to CVS, or you go to a pharmacy, you go to Costco, if you just purchase one of those over-the-counter sprays and then just cross-check that they're on the list, typically they will be quaternary ammonia, and you would spray it onto the surface and then wipe down. You should be fine. If you work with a janitorial service, then they get a little more sophisticated, where they buy, you know, like a 5-gallon jug of disinfectant that they may dilute. Sometimes you'll have a janitor closet where you'll get a large 5-gallon, your janitorial staff will get a large 5-gallon, you know, container of this product. They'll dilute it, and then they'll actually go through the workplace and use that product on the janitorial end. But again, on day-to-day office, if you're just worried about, you know, your lunchroom or your specific work surface, again, any over-the-counter product, you could cross-check to make sure it's on the list. And again, it's the EPA list N. And then it is very difficult to search because it is over 400 products. And so the easiest way was you just click on, again, there's just a button where you could click to extract it all into Excel, and it'll do it for you. And then once in Excel, you can actually search a lot easier.
Great. No, that's good information and good to know. And our last question could go to both of you, but I'll start with you first, Lori, and Deanna, if you want to chime in here. And this was, I know, covered briefly, but probably is just as important. And we talked about if an employee comes back to work and unfortunately comes down with COVID or gets sick, what are some of the best practices that you're seeing employers, small and large, do to assist not just the employee that's sick, but the other employees that are in the office that may have come in contact with that employee? And again, everything from keeping them safe, but also some mental health services that you had mentioned as well. Can you expand upon that?
Yeah, so basically, one of my clients, again, they've actually had, I think they've had 9 cases so far. They have a pretty large population. So again, the first step is making sure, again, communicating to the employee population that they're sick. They have to let you know. So a lot of times, past, you know, we've tended to come to work with like the sniffles or, you know, a cough, and we will still feel obligated to work. So really communicating to the employee that they need to let us know that they're not feeling well. And then we've also tried to make sure that the employer has a connection either with like a nurse helpline, some type of occupational health clinic, so that that employee can immediately be put in touch with the nurse triage line to make sure that they can identify the symptoms and either confirm that it's not COVID, so that person doesn't need to get tested, or to proceed with testing. And then the other important thing is if that person is actually at work, to make sure they understand that they need to let us know right away that they're not feeling well, so that we can isolate them. So the other consideration is to make sure there's some room, it could be any room, that you can put the person in, to isolate them as soon as they feel that they have symptoms. And then once they're, you know, your HR person can talk to them, or manager, to say, you know, how are you feeling? We really need to send you home. So isolating that person if they're feeling ill, and then sending them home. And then after that, again, having in place some occupational clinic who can facilitate the testing and also follow-up care for that employee. So again, getting that occupational clinic set up prior to having people come back to work, which you may already be at work. So again, trying to get that relationship with an occupational clinic or testing facility prior to someone contracting COVID at your workplace is important. So you can facilitate the timely testing of that employee, and then if necessary, working with that nurse to test not only, as you mentioned, the primary employee, but any secondary employee who came in contact with that person. And typically if it's greater than 15 minutes of contact with that person, where you want to definitely follow up and test those other people and isolate them.
Great. Well, thank you for that. And we've got just a minute here, but Deanna, I'll kick it over to you for maybe a 30-second wrap up, and then we'll go ahead and close up the webinar for this afternoon.
Yeah, thanks, Jeremy. And just to add on to what Lori said is, we've seen, clients that do have COVID cases, and a lot of employees might enter a building with their badge. So they're able to track who's in the building that day with that individual, and let those that have worked closely with that individual know, and the managers follow up with them. And then also even have an email that went out to folks, let's say on multiple floors within that building, if it's a larger organization, because, we are seeing it, it's reality of the workplace today. So to have a strong communication protocol with your management and your team is really important. And to think about what that fact sheet, what that playbook looks like if you don't have one, to make sure that you keep that updated and that you don't tune out now that you have your protocol in place, that you keep upping your game in order to really kind of stay in the game.
Oh, that's great. Really appreciate that. Lori, Deanna, can't thank you guys enough. Lots of great information. We're glad we're recording this, so folks can go back and take a look at that. If anybody wants to reach out to AECOM, please check our website, our online directory. They're listed there. Or give me a ring and we'll get you contacted with Lori and Deanna if you can utilize their services. We can't thank AECOM, both Lori and Deanna, enough for the partnership and for today's presentation. Without you guys, it wouldn't have happened. So thank you. More information on COVID resources, please visit the chamber at lbchamber.com. There's a big red button there. We're constantly updating that page and providing resources and information for all of our members and the community at large. This has been another webinar brought to you by the Long Beach Area Chamber of Commerce. And again, thank you to our partner at AECOM. Everybody have a wonderful afternoon. We'll be in touch. Thank you.
Thank you.